All right, let's get started. A very warm welcome to all of you on, today being the day on the week of, International Women's Day. Satva is very excited to be hosting this webinar on managing your period with Ayurveda. A very quick introduction about Satva. So we are a tech startup based in the Bay Area, and we have a mission to make Ayurveda and Yoga accessible to the whole world. And Satva is very excited to be hosting a number of events on the occasion of International Women's Day, or rather Women's Month. Rather, we have a number of events. We have, of course, webinar today and another webinar tomorrow on healthy pregnancy and newborn with Ayurveda. We also have a few other events, and which I will be talking about towards the end of today's webinar. We have a number of blog posts coming up, and a lineup of activities which I'll share more about. So without any delay, let's get into today's webinar presented by Dr. Aruna. So Aruna has a BA/MS, Bachelor of Ayurveda Medicine and Surgery, and also an MSc in Biochemistry. And she's a director of Atharvani Ayurvedic Center in Mumbai, and she's also the VP of Wellness for Satva. Aruna specializes in a number of issues: panchakarma, skin and hair issues, PCOD, hypertension, diabetes, joint care, and also general health. So we are very excited to welcome Aruna to present today's webinar. And by the way, a fun fact, 3 of the 4 founding members of Satva are all women. So we are actually very excited to be hosting today's session. So over to you, Aruna.
Yeah, first of all, a very warm welcome, and I wish you a happy Women's Day to whoever is watching. So we'll get into the topic for today, managing your menstrual cycles with Ayurveda. In Sanskrit, it is also called Rutu Chakra. That Rutu actually means season, or we can say something which occurs repeatedly. So these menstrual cycles occur repeatedly in a woman's life. That's why it's called Rutu Chakra, and it keeps happening regularly. Okay, usually a normal cycle, which is actually within a duration of 27 to 28 days, which is very much coincidental with the moon calendar or the lunar month. So even a moon takes 27 days to make one round around the earth. And the number of eggs is already pre-decided in the womb when the girl fetus is being formed. That is, approximately she will be having 40,000 eggs in a lifetime to be produced, out of which in every cycle, out of 4 eggs produced, 3 will diminish and only 1 will mature, which is what is the mature egg, which comes every cycle. So approximately 12 to 13 cycles a year is a normal menstrual cycle periodicity. Yeah, we'll go to the next slide. So to give you a brief idea about the menstrual cycle, okay, usually it lasts for 28 days, what I told you. The first day we can consider as the day when the bleeding is seen. So that is called the menstruation or the Rajasrava, where the flow of the menstrual blood happens. It usually lasts for around 1 to 4 days or 5 days in different part of the cycle. And I'll be talking about what dosha is controlled. I mean, what dosha controls every part of the cycle. Okay. I'll just go into the modern medical terms. So the next part is the ovulation, where the egg production actually takes place. So as I was telling you, 4 eggs actually get formed, out of which 3 diminish and become immature, and only 1 matures, which is actually the mature egg, which comes in the ovary and is actually drawn into the uterus sac for the conception. If it doesn't conceive, it comes out as the menstrual blood. Okay, so this ovulation is the what you can call as the fertile period of a woman. So it lasts from the 5th or 4th to 16th day, and the ovulation actually takes place on exactly one day, which is and the egg lasts for 24 hours inside the woman's body. So approximately this is the ovulation period, that is the body prepares itself for the ovulation mechanism to happen. That's why I've given 5th to 16th day. It may happen around the 12th or 14th day depending on the person. Secretory phase is the next phase, where the uterine lining actually increases in case there is conception. Hence, the body, again, the uterus is prepared for the baby which is to be formed. So the 17th to 28th day, the endometrial lining or the lining inside the uterus actually thickens over time gradually, and in case the conception doesn't happen, then it comes out as the menstrual blood, what we see as menstruation. So this cycle continues. So the first phase, that is menstruation, is, you can say, it is like it is governed by a pushing force, which is controlled by a dosha called vata. We have three doshas, that is vata, pitta, and kapha. Vata can be correlated or not correlated. It is actually made up of two components, that is the air and the space elements among the 5 elements. So this is the vata dosha, which we can call, is responsible for the pushing out of the menstrual blood. Hence, that is responsible in the menstruation. That's the 1st to 4th day. Then the pitta kala, or the ovulation period. Pitta actually is a combination of water and fire. You can say it is a moving fire. A fire with motion. So that is actually pitta, we can loosely correlate it to. This is, you can say, it is the component which is responsible for the metabolic functions or the enzymatic pathways, all these things. So pitta is responsible for the production and the maturation of the egg in the 5th to 16th day, that time period. Then the secretory period, that is the kapha dosha, actually controls this part of the menstruation cycle. Usually kapha is a combination of earth and water elements. So as we can see, the buildup of the endometrial lining is controlled by the kapha component. That is, in our body, it is responsible for building the physique and the strength and the build of the body. So this completes the cycle, and it goes on until the woman is in her reproductive years. Yeah, next. So which is what I just told. I'll show it pictorially. That is the anatomy and physiology. I'll just get into a little brief detail. It is the same thing which I just explained. So it's the day 1 to day 4, as we can see. It is the menstrual cycle, the menstruation phase, where you can see in the first picture the blood actually, the menstrual blood comes out. And again, why it takes 4 days is because the uterus gradually it pushes out expels out the endometrial lining and the blood tissue. So the uterus actually undergoes a corkscrew kind of movement. Hence, some people feel cramps in the lower abdomen because the blood is getting expelled out. So the next is the proliferative phase, that is 5th to 16th day or so, as we can see, where the ovulation actually takes place. And then the last, that is the secretory phase, is actually where the endometrial lining gradually thickens, okay, for the incoming conception material. Yeah. Next. So this is the you can say this is the metabolic routine of any organism, usually a mammal. We'll take a human being here. So the food what we consume directly affects the quality of the sperm and the egg. We are talking about egg here, which is a female, this one. So the healthy food leads to a healthy egg. So there is no doubt about it. And of course, the food is what we consume initially, that gets transformed by various enzymes and hormones on the way, uh, in a very controlled manner. That is, the food gets transformed into the first tissue of the body, which we can call it as plasma or the lymph, the fluid component of the body. This further gets transformed. When I say transformed, it's actually an action of various enzymes and other pathways, which actually takes a few components of the previous tissue into the essential components of the blood tissue, and the and again from the blood tissue it gets transformed further into the muscle, and again thereon from the muscle it gets transformed into the adipose or the fat tissue, and then from the fat tissue it goes to the bone, which we can see, and then from the bone, the bone tissue gets transformed into the bone marrow. The bone marrow is within the bone, which is actually the most active part of the body. They are continuously producing cells as we are talking now. So, and then the bone marrow gets transformed into the sperm or egg. So we can see the egg is the last and final product, or you can see the essence of the metabolic pathway is the egg or the sperm. So the health of the food directly correlates to the health of the egg. Yeah. So we'll just get into some few problems faced by women during the menstruation cycle. The usual problems faced will be the first problem is irregularity or absence of the menstruation cycle itself, or that is the person will find no bleeding or sometimes spotting. So this is one of the major problems. The next problem is the occurrence of a white discharge, which is actually kind of a thick uh, sticky fluid which comes out during or prior to the menstruation cycle, which is also called as a white discharge. It can be associated with foul smell or curdy appearance. The other most common problem is cramps, lower abdominal cramps, or and also associated with or without a headache. I will tell you exactly what happens in this one later on in the further slides. Then, or the other problem could be heavy bleeding, and the other problem which usually people face, but will be trying to hide it, or some people actually go through it, is the mood swings. The mind actually undergoes a lot of stress or some irritation kind of feeling will be there during the menstrual cycle. So it's not that everybody undergoes all of these. Some people may not undergo any of these problems. Some people might undergo one or two of the above said problems. So what could be the causes underlying these problems? So we have a gland which is located at the neck. I think it's kind of become famous now. Everybody wants to get the thyroid gland tested. So it is a gland which actually controls most of the metabolic pathways in the body. Uh, so the gland, when imbalanced, can lead to an irregularity or can lead to the above said problems in the menstrual cycle. Thyroid gland imbalances. Usually, the main cause for the gland imbalance is again lack of sleep during the night time. Okay, or too much of mental stress. So anyway, even about this we'll get into detail in just the coming few slides. And then ingesting of heavy to digest foods, like for example having too much of uh, bakery items, or too much of too many biscuits, or having something oily and like for example if you have a sweet which is fried sweets, even that is again heavy to digest. So, or if you can say the processed foods, spicy foods, especially here the green chili I want to include here, or the intake of fermented food, which again includes the bread, the biscuits and all these things, or the pizza base, which is all fermented, and even idli dosa, which contains black gram, which is fermented, again is can be one of the causes. When I'm saying these intake of this food is when you take too much of these foods. That is, for example, if you're taking the whole month, if you're taking this kind of food, definitely there will be an effect on the menstrual cycle. So the other cause can be alcohol intake. Again here, when you take alcohol beyond a certain limit and with more frequency. Mental stress is one of the major causes for the above said problems during menstruation. Mental stress is again uh, what it could be because of lack of sleep. It could be because of sleep disturbances, which is the other cause. So, or taking, having a lot of unnecessary thoughts can also lead to mental stress. This again leads to an impact on the ovaries and their health. So, and lack of yoga or lack of exercise, basically lack of stretching of the lower abdomen area uh, can be one of the main causes. And yoga, I mean to say yoga, which includes even pranayama, dhyana, everything, and exercise. Exercise again here, it could be walking, or it could be cycling, or it could be playing any sport. Here, I would like to say one point that there has been a research done by a few students on the kabaddi women players. So they were asked about their whether they have any of these problems which I just mentioned. They said we don't even know that we are actually having a period coming by. They in the sense they don't have any cramps, they don't have any irregularity, they don't have any mood swings. So basically the body is so fit, that is there's a flow of beautiful energy in the whole body because of their exercise and their sport. The cramps are absolutely not felt by them. They don't know what is the meaning of a menstrual cramp, and they don't know what's a mood swing. So that is the effect of exercise and yoga. Or again, too much traveling, especially late night traveling again, or traveling with your legs hanging down for too long in a seated position also is can lead to the opposite problems. Next. So the first problem, which I just mentioned, is the irregularity or the absence of menstrual flow. It can be due to one of the main problems, PCOD, that is polycystic ovarian disease. The name sounds very scary, but actually it is polycyst in the sense, as we can see in the picture, it is as I told you, every month 4 eggs actually get produced, out of which 3 diminish, and only 1 gets mature. So when this 1 egg is not able to mature properly because of any of the above causes, it gets accumulated inside the ovary itself. It doesn't get expelled out, and it doesn't reach the uterus at all. So this condition is called PCOD, or PCOS. S stands for a syndrome where it includes more the other symptoms too. So the usual symptoms what are faced is a person tends to gain weight, again because it's an interplay between the female hormones, which is nothing but steroid based hormones. Hence there is a imbalance in the metabolic pathway of the fat accumulation of the body. Hence there is a unforeseen weight gain because of PCOD and irregularity of periods. Basically the period is like a natural cleansing mechanism for a woman, which has to take place every month. If not, the person tends to accumulate the unwanted fat and other tissues. So that's why the weight gain. Then the other symptom could be fatigue and feeling lethargic. When I say lethargy, I don't mean just being lazy. It is like you have no interest to do any work, though you want to do it, but your body is not allowing you to do the work. Fatigue is again getting tired for a little physical exertion. Okay. White discharge can be associated with PCOD. And hair fall is one of the main symptoms. What is seen, which is scalp hair fall. I mean, facial hair growth is again an effect of an increased level of male hormone called the testosterone, usually in PCOD people. Hence, there is a appearance of the facial hair. Generally, the beard and even the side locks are also seen to be will be seen increasing. So what could be the possible solutions or the remedies? The first and foremost is panchakarma, which is the uh, purificatory therapies of Ayurveda, based on your prakriti, based on your lifestyle, based on your dietary. We can suggest what panchakarma is required for you. Generally, we give something called virechana or vamana. Again, we need to have a one-on-one consultation. Only then we can decide what panchakarma therapy should be given to you. And along with that, we also prescribe Ayurvedic medicines, internal medications, which is to be taken at least for a period of 1 to 3 months, depending on the severity of the problem. And then the main solution, or the very easy solution, is to avoid the causes. The causes which I just mentioned, to avoid heavy to digest foods, fermented foods, alcohol intake, or mental stress, or sleep imbalances. All these are causes which we can actually, which is in our hand. So we can avoid these causes, which can definitely avoid the appearance of PCOD. And PCOD is reversible. It's not an irreversible problem. So this is one of the main sutras of Ayurvedic treatment, okay? Avoiding the causes. Nidana parivarjanam eva chikitsa is what is told. Then including cow's ghee in the diet and sesame oil. Sesame oil has a lot of phytohormones, which is very much in what do you say, in sync with the molecular formula of the female hormones. Hence, sesame oil is very much indicated in the diet for a female. And cow's ghee also has a good amount of HDLs, or the high density lipoproteins, that is the good cholesterol. Okay. So the weight gain actually gets it's taken care by including cow's ghee in the diet, and also it helps in the production of healthy eggs. And yogasanas, to name a few, I have just named a few here. Again, what I told you, basically the asanas which help to open up the pelvic region and thereby strengthen the uterine ligaments. The asanas to be done, of course, it is always preferred to be done under a trained yoga teacher. We have some yoga acharyas here too on the Satva platform. So I'll just name a few. Bhadrasana, where is usually everybody knows it as the butterfly pose, where the knees will be completely stretched outwards and the feet will be together. So that is Bhadrasana. Pavana Muktasana is again basically to help the to balance out the Apana Vata, that is the Vata which is controlling the flow of the menstrual blood. Janu Shirshasana, where there is a in this asana there is a lot of strength given to the uterine ligaments. Hence, these few asanas I have just named here. Yeah. So the next problem, I think we missed one slide of white discharge. Yeah. So white discharge again is actually a fluidy discharge which is seen by a lady. This we can say should not be what do you say? It should be immediately controlled whenever the white discharge is seen. So we need to immediately find solutions for the white discharge happening. It's basically, we can say, it is the essence of the person, or the vitality of the person will get lost if there is more of white discharge happening. So generally the person faces a lot of joint pains with or without crepitus. So what is crepitus is nothing but the crackling sound when you place your palm over a joint and you can see a crackling sound. That is called crepitus. It could be with or without this crepitus joint pains. And a person sees hair fall, And again, fatigue, that is just little physical exertion, person feels tired. And because of the white discharge, they tend to get dried up in the vaginal area. So this leads to itchiness in the vaginal region. These are the few symptoms. And these solutions, of course, we have again a few panchakarma techniques. The first is yoni dhavana, where we wash the vagina and the tract with medicated decoctions. Of course, it is to be done by a trained and authentic certified Ayurveda doctor. And the this yoni dhavan can be followed by yoni dhupana. Dhupana is nothing but fumigation of the vaginal region after a wash with medicated smoke. Again, we have a combination of few herbs which are burnt, and the smoke is allowed to uh, irrigate the area of the vagina and the tract. Also, if you want to try it at home, there is one technique which we can inculcate, is washing the vagina and the area with fenugreek, that is the methi, what we call in Hindi. Fenugreek in, we basically have to boil the fenugreek in water, and the water has to be cool, of course, and filtered, and this can be washed uh, uh, for relief. Or we can also use the curd. Instead, like the white discharge, what I told you, it can be seen as a curdy appearance. So it has to be washed with something, a similar product, which is again curd or buttermilk. We can add water to curd and wash it with that, or buttermilk, which is the churned curd, also can be washed for relief. And also, intake of buttermilk is one very good remedy. And of course, internal medicines will immediately help in arresting the white discharge. And for itching, there are various medicines, creams, and other applications. Also, at home, you can apply cow's ghee or coconut oil. Yeah, externally. Next. Cramps. Yeah. So, here the cramps are felt generally by people who are on the thinner side. Um, and in case that there is an imbalance of the diet or the lifestyle, few days prior to the menstruation cycle, the cramps are felt more. Okay, for example, if a person indulges in too much of bakery products, that is too much of bread, cake, and idli dosa prior to the date of the menstruation, or if at all the person lacks proper sleep, night sleep, or there's a lot of thinking happening, then the person tends to get cramps and a headache during the menstrual cycle. So the other symptoms associated are nausea, headache, as I told you, and some females can experience even the breast tenderness, and usually they tend to get scared. What is this? But usually it's a common symptom faced during the menstruation cycle, is the feeling of tenderness of the breast. So in case of doubt, it's better you go and get examined by a doctor. Okay, so yeah, and why these cramps are caused is when there is an imbalance of the apana vata, the vata controlling the menstrual flow, the pushing force. When that has got imbalanced, the vata which is flowing in the head and neck region, and in the abdomen, they both tend to flow downwards, and to help the apana vata, that is the vata for menstrual flow, and hence the person tends to get a headache. So balancing the apana vata is very important during the whole month, you can say during the entire life. So what could be the possible solutions for cramps is external application of castor oil or umbilicus is one of the very good solutions and very immediate. And we have marma points also, which I can just show you. There is one marma point called Indrabasti marma, for especially for cramps. if I'm visible to everybody, there is a marma point here when we need to fold the hand from the elbow towards the palm, 4-finger length, and that is called the Indrabasti marma point. This also, when pressed and released like around 15 times, this also immediately releases the cramps. The same Indrabasti marma is found in the lower limb also. If you want, I can show it to you later, just at the end of this session, and just go through this slide. And chewing a few seeds of fennel or somf, ajwain or cumin, that is jeera, also will help in relieving the cramps and the headache. And a person tends to not eat because of nauseated feeling or a headache, but never do this. Always eat something and don't stay hungry whenever you're feeling a cramp. So eat something hot, eat something light to digest, especially like khichdi or pongal, what we call as, or nothing but the a mixture of cooked rice and cooked green lentils. So this is a very good diet to have during the menstrual cycle, especially when a person is feeling cramps. And of course, we can garnish with ghee and jeera and little ginger. So not staying hungry is one of the good solution. And sipping of hot water is also a good remedial measure we can take. So in case a person is feeling too much of nausea and not able to eat, so just smell a chopped lime, or even consuming lime water or sweet lime, that is musambi or orange, or even kokum fresh juice with a pinch of salt and rock candy sugar is also one good remedy for reducing the nausea and the cramps too. And in case a person is feeling a lot of headache, prior to the period or during the period itself, the person can instill cow's ghee as nose drops or sesame oil into each nostril, 1 drop, either at bedtime or if at all he's feeling a lot of headache during that time, make sure that the person is on empty stomach and then instill the drops, and then she can rest for a few minutes and then she can have some food. For in case a person is feeling a lot of breast tenderness, first of all we need to learn the breast examination, which is a different topic altogether. Or you can also apply a thin paste of aloe vera pulp. That itself will help in reducing the tenderness, or just allow the menstrual cycle to pass through. The feeling of the breast tenderness also will reduce. Also, there are some other few remedies for cramps. Is having coconut water is a very good remedy, and having elaichi banana, that is the small variety of the bananas, is also very good for reducing the cramps. Yeah, next. So in case some people may experience heavy bleeding. Heavy bleeding, again, it can be understood when a person is using more than 3 pads a day. Okay? And in the night, again, you have to change 2 pads. So that is called heavy bleeding. Okay? That is more than your normal menstrual flow is called heavy bleeding. Okay? So immediately we need to address it. Again, the symptoms phase are general body weakness because there's a lot of blood loss more than usual, and there is a hair fall because of a decrease in the hemoglobin content. Okay, and also heavy bleeding can lead to bone pain, that is joint pains too, and some people experience a sense of dry mouth. So what could be the solutions? Solutions are again simple. Internal medicines is very effective to arrest the heavy bleeding. Internal medicines, of course, will include iron containing medicines, and eating pomegranate, which contains a huge amount of iron. Iron content is a very good remedy. And if at all you are having access to buying organic pomegranates, then you can eat the fruit, and you can take the decoction of the peel itself, and which is more effective than just eating the fruit. So the peel can be removed. It can be even kept for drying also and used later on also. And the peel itself can be boiled and used as a decoction to arrest the heavy bleeding. And of course, avoiding spicy, fermented, and deep fried foods deep fried and fried sweets also are to be avoided. Yeah, next. So mood swings is again one of the important symptom, and again it has to be addressed to the most of the solution remains in your hand, and also we'll see this different solutions what can be the thing. The symptoms are generally there's a sense of anxiety just before the onset of period. That is when a person is regular in keeping track of the dates, and suppose the day is approaching, maybe in the next coming 2 days, the person gets anxious that there is going to be a period going to happen. So this anxiety itself will build up a lot of mental stress in the body. So try to drop this anxiety. Okay. And again, a feeling of lethargy during menstruation, and a person wants to do nothing in life. This is also there, and there is a sense of irritation. Okay, and usually a person tends to get angered easily, also because there's a proverb, a hungry man is an angry man, so hungry woman is an angry woman. So where the person would have actually not been able to eat because of the different symptoms what I told you, because of nausea, because of cramps, the lady would not have eaten, so hence she'll be hungry and she'll be easily triggered to anger also. So these are the symptoms. And what are the solutions? There is a very good yogasana. There's a what do you say? It is actually a kriya. What do you say? It's not just one asana. It's made up of many asanas. This Chandra Namaskar, as we have heard about the Surya Namaskar, there's something called Chandra Namaskar. Of course, don't do it during the menstrual period. Just prior, or when in the Pitta and Kapha phases, what I told you. That is the 5th to 27th day. You can do this Chandra Namaskar every day, at least 2 rounds. Usually it starts from the left and ends in the right, and you have to end again, start from the right and end with the left. So that will be 1 round. Then 2 rounds of Chandra Namaskar is recommended at least. And again, as I told you, 4 to 5 days, at least prior to the period date, you can do it. And there is something called Chandra Bedana Pranayama, where we need to inhale and exhale only through the left nostril. That is, we need to close the right nostril and inhale only through the left nostril. This is the Chandra Nadi, which helps in the flow of the menstrual, which helps in the regulation of the menstrual cycle. Okay. This can be done 11 times at a stretch. It can be done once or 3 times in a day also. And make sure you're on an empty stomach. And activation of, again, a few marmas are there, which is very good for managing the mood swings. That is Tapani and Adipati. Adipati marma is at the back of the head. That is where the shika is seen, in where the hair tuft is seen. That part is Adipati marma. Tapani marma is in between the eyebrows. Again, this with a gentle pressure, you can activate these marmas anytime in the day. With a little pressure, that is 15 times, just do it. That will also help in managing the mood swings. And as I told you earlier, never stay hungry, okay, because you might tend to get angry and further mood swings will build up. Okay? And again, sip warm water throughout the day. Like every half an hour, you can keep sipping warm water, or a mild decoction of Indian sarsaparilla, also called as sariva, or vetiver, again, or called ushira. These two are very good herbs for calming the person down and cooling the person, okay, physically and mentally. Yeah. So I think, yeah, next. Yeah. So I think I just hand over to Dr. Suchitra to take over from here. Thank you for listening. Thank you all.
2 more minutes for us to conclude this webinar. So I think this was great. Wonderful. Thank you so much, Dr. Aruna, and thank you all of you for joining in. So thank you so much for your encouragement and for your participation, and hope to see you all again very soon. Thank you so much.
Thank you, everybody.